Novel immunotherapy improves recovery from spinal cord injury. Severe injuries to the spinal cord damage nerve cells, disrupt communication with the brain and rest of the body, and lead to lasting disabilities for millions of people worldwide. The injury itself accounts for only a fraction of the overall damage inflicted on the spinal cord, tissue that runs from the brainstem to the lower back. Most of the damage is due to subsequent degenerative processes at the wound. While there is substantial research into developing interventions to repair injured tissue, scientists at Washington University School of Medicine in St. Louis focused instead on developing an immunotherapy to minimize the damage from traumatic spinal cord injury. Their findings show that immunotherapy can lessen such damage by protecting neurons at the injury site from being attacked by immune cells, presents a novel approach with potential to help improve outcomes for people recovering from spinal cord injuries. Shortly after injury to the nervous system, immune cells flood the site. Among them is a mixture of activated T cells, a subset of immune cells that either harm or protect the surrounding neurons. The protective T cells that swoop into the injury site can mistakenly attack the body's surrounding tissues when activated for too long, causing autoimmune disease. Modified T cells had better mobility than did the untreated. The researchers saw the biggest improvements when infused with T cells within a week of the injury. None of the members receiving immunotherapy developed a destructive autoimmune reaction. Immunotherapy for such injuries by taking advantage of the protective immune cells that infiltrate the injury site and found that it dramatically improved mobility. For further opinion management or treatment, please connect Dr. Sanjeev on WhatsApp 93232758869.